Good evening, doctors. This is Makesh from Forts India, General Manager Marketing. Uh, Let me have a great pleasure in welcoming you for the webinar, which is an very important topic that we are going to discuss today. And everywhere, if you see, starting from the government to the layman, everybody is relying on one thing. Today, if you see that is three things are recommended by the Ministry of Health and Family Welfare. One is zinc, the other one is vitamin C, and the third one is vitamin D3. So there are so many formulations available today with zinc. We have today have a eminent personality, Dr. S. Venkatramanan, a senior consultant diabetologist, Apollo Hospital and Sooriya Hospital, and doctor is a professor of diabetologist, and he has a vast experience as a PG teacher and clinical diabetologist for more than 35 years in the medical field, and sir has published many articles in the peer-reviewed journals also, and sir worked as a co-investigator for ICMR studies on type 2 diabetes mellitus and investigators for drug trials including inhalers of insulin. And the proud moment is that doctor received a lifetime achievement award from IDF and many awards from IMA. And now we have Dr. Venkatramanan. He will be discussing with the role of zinc and many interesting facts about zinc, how that will be helpful in fighting or preventing from the current COVID situations. So let us have a wonderful discussion, and over to Dr. Venkatramanan.
Good evening, friends. At the outset, I would like to thank Forts for this endeavor. To be very frank with you, even though, as Mr. Mahesh just now alluded to, certainly there is a space for consideration of the micronutrients and mineral supplementation in the present day context. What I thought was the platform given by Forts for today evening from molecule of theirs, we can utilize this space for some discussion, revisiting our basic physiology, and then ask ourselves some pertinent questions and try to answer. I'll give a brief introduction, and before I go on to the main presentation, I would like to submit that whatever we are discussing with respect to the role of the micronutrients in general and zinc in particular are based upon number one, in vitro animal studies, number two, small observational data on zinc supplementation, not necessarily with respect to COVID-19, but with respect to similar related seasonal viral infections. And number three, we also have the data from the animal experiments, which combined together, all these three put together, I think it will make ourselves think, in the sense that right from our undergraduate days, we have always been talking about the role of micronutrients. I'm sure, right from MBBS, post-graduation and super specialty, every time we discuss about the micronutrients, the minerals and the vitamins. But when it comes to a situation, I think we need to ask ourselves, is there a scope for suspecting a deficiency of a particular micronutrient in this scenario? Number one. Number two, if there is one, and do we need to measure the deficiency, or we can supplement it as a form of preventive or corrective measure? And number three, do these micronutrients have any role in therapeutic, do they have any therapeutic advantage, especially in the context of the diseases that we are going to discuss? I think there are no final answers for this. I think at the end of the discussion, each of us, I'm sure, will have the wisdom to decide amongst yourselves as to how to patronize this in the context. But I thought we'll utilize this opportunity, as I keep on telling, to visit some basic physiology and then go on to make my presentation. Zinc is an integral component of many metalloproteins in the body. This is fundamental, we know that. It is absorbed from the upper intestine. The body stores good amount of zinc to the tune of about 2 grams. These rich stores of zinc is distributed in 4 or 5 tissues: liver, prostate, pancreas, bone and the brain. It is responsible for immune function. Deficiency can produce night blindness, etc. There are some dietary sources. For example, meat, shellfish, nuts and legumes are good sources. When you restrict the macronutrients, inadvertently, there is a diminished supply or intake of micronutrients, number one. Number two, even the micronutrients that are being consumed, the absorption can be interfered with the fibers, because we know the advantages of fibers. We always push and then maximize the consumption of fibers for its own attendant benefits. But now we are talking in the context of the zinc metabolism or zinc absorption. So in this context, liberal fiber intake can be a detrimental to the absorption. Number three, there are certain drugs, like for example, ethambutol, sodium valproate, which are not uncommon to be used in clinical practice. They can interfere with the absorption of zinc. Now, there are two aspects. Whenever we talk about the minerals and the micronutrients, we always used to discourage the supplementation in the form of a pill or a therapeutic supplementation or a B-complex vitamin. We always say, take it from the natural sources. There is certainly certain amount of reduced intake or supply of micronutrients when you have a limited supply of vegetables and fruits. Number one, we are restricting the macronutrients. The micronutrient consumption is going to come down. Number two, there are other factors which can interfere with the absorption of the micronutrients. And number three, the reliable sources of minerals and micronutrients, which we have been encouraging all along and which we should continue to. Unfortunately, because of the fertility of the soil, this fertility of the soil is not just a random sample. They have taken about 1 lakh samples across the country, and they have found out that the fertility of the soil has come down. Restriction of macronutrients, encouragement of fibers, and then the nutritive content of the natural sources of these vitamins and minerals has come down. It has been proven. So this makes us speculate whether blanket prescription of a good vitamin supplement, especially in situations like, for example, your diabetes, obesity, atherosclerotic cardiovascular disease, people in whom you restrict the calories, people who do not have much access or who are reluctant to consume so much, and in pregnancy, you know that you always talk about the extra other things and all. In them, probably it is worthwhile considering a blanket prescription for all the reasons that I have done. We always talked about the macronutrients, the carbohydrate content, the protein distribution, the saturated fat, the cholesterol content, etc. Then other aspects of the diet, etc., etc. Whereas, but in the context of the normal population, when we ask ourselves the question, are we doing enough justice for the micronutrients, such as those supplementation, which is not going to be detrimental in the long run, which are associated with benefits, in my opinion, can be recommended in the day-to-day. Now, before I go on to the presentation of the immunity and zinc, whenever we talk about the immune system, we always talk about the humoral immunity as well as the cellular immunity. For this, all the vitamins, vitamin A, B6, pyridoxine, B12, C, D, E, folic acid, zinc, selenium, these are all have been found to play a role. If there is a deficiency, then there is a theoretical reason to expect such individuals to handle the disease in an unfavorable way, and then supplementation is justifiable. It will enable the patient's immune system to handle the situation better in the form if there is deficiency, and maybe in certain situations based upon some inputs. For example, there was a good Cochrane data wherein zinc supplementation has been associated with reduced infection. Zinc supplementation always makes the population handle the viral situation better. For example, the Cochrane data shows that the time period from the nasal cold, the common cold, is shortened if there is zinc supplementation. So this is a piece of an association, and you have to interpose it or link it with the theoretical knowledge that we do have. Now, before I go on to the immunity, I think we all heard about chloroquine, hydroxychloroquine, having a favorable effect on the COVID-19. How does it do it? Chloroquine acts as a zinc ionophore. What do you mean by a word zinc ionophore? Zinc ionophore means it facilitates the entry of zinc from the serum into the cells. In fact, it has been that the protective or even the therapeutic effect of chloroquine, hydroxychloroquine, could be because of it's a very good zinc ionophore. It facilitates the migration of zinc from the serum. So, in other words, even from the mechanistic point of view and understanding the cellular biology at a deeper level, there is a scope for supplementation of micronutrients and minerals in this scenario. Now, we will go in very, very slowly. I have got hardly about 10 to 12 slides that I am going to throw today. The material is derived from only one review. You can see it here, the International Journal of Molecular Medicine, July 2020. I think it was published in April 13, accepted for publication April 13, 2020. The first author is from Moscow, Anatoly Skilani or somebody. Yeah. So my talk is based upon this beautiful review, which has gone into the greater details about the possible role of zinc with respect to the viral infections in general, and then maybe extrapolated to the context of the COVID-19. That is number one. And number two, there are very, very limited, there are no clinical data available with respect to the usage of zinc and minerals in the COVID-19, but in vitro data with respect to SARS-CoV as well as the previous virus, the Middle East Respiratory MERS virus, and also, as I told you, most of these are in vitro data based upon animal experiments and worthy of exploration and probably a patronization in the human context for the advantages that they do have. The simple means of just prescribing a good brand of vitamin with good amount of zinc and other micronutrients, because you are not going to do any harm. And for the reasons that I have already discussed in greater detail, you are justified in assuming that most of the population could be deficient in the micronutrients. See, I told you about the soils and crops. So 40% were found to be zinc deficient. So one can have a liberal consumption, but still they could be deficient because it is not their fault, because the minerals and the vitamins, I repeat, which should be supplied by these vegetables and fruits, are deficient in quality because of the soil behavior. And it is not in India alone. It is across the world, to the tune of almost 20%, 1/5 of the population are zinc deficient. So now, having seen briefly the micronutrients, their physiology, and then their role in immunity, and some of the association, I didn't throw a slide, I just gave you the example about the Cochrane data, wherein supplementation with zinc has been associated to have a favorable effect in some of the viral infections like common cold, and probably, it is speculative, might have some beneficial effect in situations like this, wherein we are encountering a viral infection, it is pandemic, it is taking a toll, it has disturbed our quality of life. We have been asked to adopt quite justifiably measures like social distancing, masking, hand sanitization. On top of it, if anything else might be helpful, certainly it's worthy of consideration, provided it is not expensive, it is not risky, it is physiological, and there are human data as well, not necessarily with COVID-19, but with respect to other similar virus infections. So we are going to talk about the role of zinc and COVID-19, or any viral infection, or some bacterial infections as well, which are going to do, as you see here, in the context of these 5 or 6. What is the role of zinc in mucociliary clearance? How important it is, we will see. And then we'll talk in greater detail, some detail about the cellular dynamics which happen in the context of SARS-CoV-2 with respect to zinc. And then there are some endogenous defense mechanisms like your interferon protection, which are used in some of the viral infections, probably hepatitis B, etc., or hepatitis C. I'm sure many of you will be much more knowledgeable about these diseases than what I am. So interferon is one thing, and how zinc facilitates the endogenous production of interferon favorably, and also tries to cut off the protein with respect to the viral replication. And then with respect to inflammation, I think this is fundamental. We'll see maybe a slide or two, how it favorably alters the immune response to suit the host or the human being, and then maybe offer some sort of a additional or a supplementary role with respect to a huge inflammatory response which is associated with enormous morbidity and mortality, and touch upon the role of zinc in certain bacterial infections as well. So to begin with, whenever you have an infection, mucociliary clearance is absolutely essential for either it's viral or bacterial aggregation, and zinc plays a role. Now, this is the first attribute of zinc to be considered in the context of a viral disease. Now, whenever we talk about the mucociliary clearance, there are two aspects. One is the tight junctions between the cells in the epithelium, which is by the proteins ZO1 and claudin 1. These are upregulated by zinc so that the tight junction forms a mechanical barrier for the penetration of the virus or other infections. Number one. Number two is the cilia. Whenever we talk about the cilia, the two things that matter are number one, the ciliary length and the ciliary beating frequency. Both the ciliary size, length of the cilia in the epithelial cells, which are supposed to ward off the infection to an extent, adding to the mucociliary clearance, the ciliary length is increased, and also the beating frequency, the ciliary beating frequency, both are increased by zinc. So the first step in any infection from a mechanical point of view, acting not only as a barrier to the infection, but also to an extent facilitating warding off the infection by clearing of the secretions, which is rich with the infective material, is facilitated by the mucociliary clearance, which is being helped or facilitated by zinc. So that is number one. Then number two, I'm sure in the context of COVID-19, all of us are very familiar with this ACE2. ACE2 is a receptor which facilitates the entry of the COVID virus into the cells. Now there was also an issue, I'm just quoting, not in the context of what we are going to discuss today. Whenever you give RAS blockers, there's an upregulation, etc. But yes, but the advantages of RAS blockers have been so good that even if they theoretically are going to upregulate ACE2, they are justifiable. This is just making a passing mention about it, just to make you recollect the context of ACE2 for some of my friends who probably might think that, what is this ACE2? Now, ACE2 down regulation is achieved by zinc, which means the zinc in the vicinity of the cell, be it respiratory or other system, does not encourage the entry of viral into the cell to an extent by down regulating the ACE2 expression. So that is number one. And number two, what does it do? The virus, once it enters the cell, the viral RNA through the messenger RNA, there's a transcription, it takes over. It's something like usurping the factory. So the virus usurps the factory of the cell mechanism, and then it duplicates, it replicates. So this transcription and translation and replication is being inhibited by zinc through this enzyme. And don't bother about this enzyme if you were academically interested, fine. RNA dependent RNA polymerase. So I was referring to the endogenous mechanism. All of us have got the endogenous mechanism to ward off the viral infections. So that is why, supposing even in peak influenza in the winter months, all of us do not have the fever. Of course, some of us have taken the vaccines. Otherwise, because there is an endogenous protective mechanism in the form of this interferon alpha. This is antiviral immunity, which is facilitated by zinc. And when it comes to viral RNA, again, the same process with the latent RNA, ribonuclease, etc., it is able to discourage the viral replication and then ward off the infection. So I'm not saying zinc is an antiviral drug like your acyclovir or remdesivir, etc. No. Zinc facilitates what the normal body is supposed to do in the form of warding off the infection by the mucociliary clearance, by the tight junctions, by the production of interferon, by inhibiting the entry of the virus, by inhibiting the replication of the virus. In these ways, this micronutrient facilitates. Now, when it comes to inflammation, there are two aspects. When you have the NF nuclear factor kappa B signaling, there is anti-inflammatory activity, and also the pro-inflammatory cytokines, as you will see here, TNF alpha, interleukin 1 beta, etc., are favorably modulated in the sense that the anti-inflammatory component is being facilitated, and then extreme inflammation could to an extent be, then the cytokine production be favorably affected or modulated by zinc. Through this manganese homeostasis, it is able to ward off and have some facilitated role in pneumonia, streptococcal pneumonia, as well as pneumococcal infections. So pneumococcal pneumonia, pneumococcal infection is something to do with manganese homeostasis, and this is being favorably impacted by zinc. So now we saw generally the situation or the scenario which can predispose the population as a whole for deficiency of micronutrients in general and some of them like zinc and thiamine. I gave some examples, iron in particular with respect to the soil content. Disease states like obesity, diabetes, atherosclerosis, for reasons again, for example, you are restricting the macronutrients. Their access to the minerals may be limited, or the absorption may be interfered with respect to comorbid conditions, or they are in, for example, some of the drugs can enhance the zinc deficiency. For example, chronic hydrochlorothiazide diuretic usage, that can result in zinc deficiency. Like for example, you have B12 deficiency in metformin, that could be drug induced as well. And then this has been found in some data that zinc supplementation can have a beneficial effect in ventilator induced injury as well. The metallothionein, if somebody is interested, that mechanism is being favorably impacted. Now, as I told you, I started the discussion with the physiology of zinc. What role does it do in physiology? What are the body stores of zinc? And then what are the ways in which zinc can be useful, and how zinc has to be procured by the body, the sources. So what are the limitation factors with respect to absorption in the form of interference with some molecules like ethambutol as well as your sodium valproate, and also the fertility of the soil, which the produce can be, the content of the micronutrient can be less, as has been tested, the soil content in 1 lakh across the country. And then the last 5 or 6 slides, we went into the greater in-depth detail about the role of zinc, which has been studied in greater detail with respect to the previous infections as well as probably the present infection in the context of the in vitro studies. From this, we have understood that zinc facilitates mucociliary clearance, which is very, very important in new viral infection. It facilitates the tight junctions, accentuating the barrier to the infection, and then it doesn't encourage the entry of virus by downregulating the ACE2, and then it discourages the replication of the virus through the enzyme, the RNA polymerase, which we saw. And when it comes to inflammation, the nuclear factor kappa B is facilitated, whereas the inflammatory process and the cytokine storm could probably be impacted favorably by zinc, again as evidenced by these in vitro studies. And then interferon alpha, which is an endogenous fighter against the virus, could be facilitated by zinc. And lastly, we also touched about its possible role in bacterial pneumonia, for example, Streptococcus pneumoniae, and how it can be useful in certain situations like this. So I think this is the sum and substance of the presentation that I do have. As I told you, there are very, very limited data in the context of the topic that we have been assigned today in the context of zinc and COVID-19. One probably the advantage of this restriction with respect to lockdown and all, so we are able to meet with each other, connect with each other, share our thoughts. So in this scenario, I think it was nice of FORTS to have, even though the agenda is, as I told you, is let's be very frank, it is for FORTS B, which has got a good rich source of zinc compared to probably even contemporary other molecules available in the market. Even though the agenda is very, very clear, we have utilized this opportunity to revise ourselves the basic aspects of science and then probably had some data. And as I kept on repeating, my talk was based upon all the information which was furnished in one review paper, which I've shared with you, and such of those who are interested can go through that so that you can revise whatever, and some other points which I might have left out in my presentation, maybe you can supplement, and then maybe you can do it in some forum like this amongst your own peers and your students and colleagues.
Thank you very much, sir, for your wonderful and detailed presentation about zinc. In fact, starting from the deficiency state that you have taken, as well as the textbook recommendations and all those things. Actually, sir, our purpose with this is that in a dark room, even a small candle will help us. So in that way only that we have been promoting this brand. And this will definitely help people to understand regarding the role of zinc, what you have discussed, these 5 points. That is the, in fact, nobody knows about COVID before. So only based on whatever the current evidence is available, based on that we have been discussing. We don't have much multi-center trials regarding the recent developments, especially for COVID. So with the available evidences, what we got is that zinc plays an important role. So based on that only, we just want to share the information. So for that only, we have organized this webinar. Yeah, one participant has raised a question, sir, now. Yeah. And they're asking how long we can give zinc supplementation safely.
Yeah, that's a good question. In fact, the textbooks of medicine say zinc toxicity, unless it is consumed with inadvertently some good amount of zinc is consumed, actually it can happen in people, in welders. The fume that emanates during welding, that can result in a good amount of zinc toxicity, which probably can be associated with seizures, etc., etc. I think people in toxicology should be aware of this. We don't come across, but the routine consumption is probably because the tissue stores, they share as a backup. There's about 2 grams of zinc in the body, which is distributed in huge tissues like your pancreas, prostate, liver, brain, hippocampus and other, because it's for neuronal activity also, zinc is very, very essential. So there is a cushion in the form of the storage in huge number of tissues. So theoretically one doesn't anticipate unless there is an accidental consumption, number one, orally, and number two, accidental inhalation of fumes by the welders could be. Beyond this, I do not know. Probably toxicologist should be able to identify and correct it. But otherwise, you can rest assured that in the pharmacological doses that we do recommend, the toxicity is not likely to happen.
Sir, as per to our knowledge, sir, as per the ICMR guideline, they are recommending as a RDA, that is a recommended dietary allowance, as 12 mg of elemental zinc per day. So that is the recommended dietary allowance, sir. Yes, sir.
So one more question from Dr. Kannan. The dosage guidelines of zinc to boost our innate immunity.
Pardon, I didn't get the question.
The dosage only, sir, is asking, sir.
Yes, Kannan from our, yeah, I know. Kannan is my good friend. Yes. Hello, Kannan. The dosage guidelines of zinc to boost our innate immunity. Thank you. Yeah, that's what I'm saying. So, Kannan, I think this is a difficult question. Are we correcting a deficiency which you presume to be present in most of the population? Number one. And then, are we considering zinc from the therapeutic point of view? So, the answer, definite answer cannot be given. But given its safety profile, even though the RDA is 12 milligrams, I think Forts B has about 20 milligrams, which is over and above this recommended intake, with the hope that possibly it can have a facilitating role with respect to boost the immunity as well. This is just a speculation. In fact, the zinc supplementation has been tried in pediatric as well as the elderly population. It has been found to be beneficial.
Thanks for sharing your thoughts, sir, as well as thank you for answering all the questions, sir. I think no other further questions are there.
Thank you, Mr. Mahesh. Thanks for the opportunity, and yes, I thank all my friends who connected with me this evening. I hope the discussion that we had today was useful to you. I look forward to connecting with you in some other platform. Thank you so much.